Aging is a constellation of failures in DNA. What does it mean?
Well, it was a failure of DNA with its environment. And that's the system. I referred to a DNA environmental system that is one way to define our reality. So the environment part of that is all of the environments that surround DNA, those in the nucleus, within cells, within the tissue, within the organs, the organism, other organisms, religions, politics, mandates, physical factors in the universe, etc. And as we get older, all of those interactions, that DNA environment system starts to fail. And those interactions among all of those layers of environment and our DNA becomes different. And we can now measure that. It's sort of a global way of assessing who we are and what's happening to us as we age.
Why study cardiovascular aging?
Aging is the major risk factor for most diseases in our society by far and away. And our population is getting very old, with many more older persons. So the numbers of people who have cardiovascular disease will increase. And in order to understand why the disease is much more common in older persons, we need to understand the answer to that. And to get the answer to that, we have to look to see what's happening to their arteries as they age. And as I explained, the molecules that are necessary for normal structure and function throughout our body, not only the arteries, those molecules lose some of their ordered processes and they don't work as well. As a global, again, an overarching view of what's happening.
How age-associated changes in arterial structure may contribute to dementia and Alzheimer's disease?
So this molecular disorder that I was referring to within the arterial wall that happens with aging leads to stiffening of the central arteries, and that leads to an increase in the pulsatility of the blood pressure. And the increased pulsatility is transmitted to organs like the brain and the kidney, and they were not designed to deal with pulsatility. They were designed to ensure mean blood flow, not pulsatility. So this can damage their microvasculature. But the same aging process that occurs in the central vessels can also occur in the microvasculature. So you get it from both sides in the microvasculature, in the brain. And of course, when you damage the blood vessels in the brain, it's like damaging the blood vessels in the heart. You get a cerebral ischemia or hemorrhages, and that disrupts your cognitive function.
If hypertension and atherosclerosis are effects of aging, is aging per se a disease, is a mother of the disease?
There's pathophysiology that we call it that underlies diseases of atherosclerosis and hypertension. And what I've talked about today usually is called normal aging of the arteries. I'm trying to convince the listeners that there's nothing normal about this, that it could be stated as the pathophysiology of aging. So then we wouldn't say that aging causes those other diseases. We would say that there's an interaction between, let's say, diet, salt intake, mental stress, etc., and what's happening with aging by itself. And when the two are added together, they reach the level of structural and functional declines that we can recognize as being a disease. In another sense, although we don't think of aging as being a disease as we think of hypertension and atherosclerosis, I think that it should be because it inevitably kills you if you don't have another disease. Only it happens slowly and we don't realize that it's happening.